malocclusion. Malocclusion? Yeah, malocclusion with the teeth. And there's a very hard tension in the muscles. And therefore you could think that many causes can stand behind it. But in many cases you will see the results come up in spite of other causes. They can overlap many causes. Once more. I didn't understand. Yes, yes. The processor styloides. Yes? Kyphoscoliosis. Yes, the same as the osteitis. You will find this problems again. So you have to look as a dentist X-ray, and you will have your examination of the mucous membranes, but for the medical doctors maybe that's a new kind of examination, a new kind of inspection that you have to learn to look at the mucous membrane.
The TMJ fit into this area.
Yes. You understand that the TMG as well as the pterygoid muscles, it's very much engaged in this area. And sometimes you can't differentiate if the pain conditions may be originated by the pterygoid muscles or by these specific signals which connect the body inner organs. This is all cavity places.
You inject in the pterygoid muscles too then?
Yes.
You also
Yes.
inject them?
Yes. The microphone?
No, this one right here.
Yeah, it's better when I speak here. Okay, thanks. You changed the battery. Fine.
Sorry about it, but I'm listening to the voice.
May I ask for a little help with my English if necessary? I don't get all the words I need. Thanks. Better now? Hope so.
The big microphone.
Better I have this. Yeah, good. Sorry. All questions answered now? Once more.
What experience have you had with seeing problems in that area with dental implants?
This is a hard question. It differs very much in the patients. I have seen patients who don't tolerate. We have heard about this morning from Professor Hopfer all the conditions that can cause an interference field, and in some patients they are so sensitive that they can't tolerate such implants, and others they tolerate it very well. I remember in Germany when we had a congress at Baden-Baden, there was a very hard discussion between Fritz Kramer, who came here 2 times, and a professor of Switzerland who was one of the most famous implantologists of dentistry in Europe, and they just met in a very hard way. But a colleague who said with me, he said to me, look at these 2 doctors. Each one of them must have quite different patients. Look at Fritz. He will have the very sensitive patients, and they come to him and he has to help them. And if he would give such hard problems to his patients, they wouldn't stand it, they wouldn't tolerate it. But look at the Swiss man. He's quite another doctor, and he will have his patients who are young and very sportive and so on, and they will tolerate also an implantation. Why not? So you have to look at the patient. I think it's the answer. Sometimes it can be very, very bad for a patient. Sometimes he's young and he is very good in his immune system and in his resistance. So why not? You can have this implantation. But as we have learned this morning, look at the patient if he has some other problems, if he has some other disturbance fields, and if he already has, I think then is the basic conditions for all such implantologies is bad. It's not the same as a healthy person. So look at the person first. Maybe difficult to give this answer, but
In energetic measurement, Jochen, I have not been able to find
What did you use for measurements? Is
EAB?
EAV, yes. EAV is electro acupuncture measurements, which they did in Pulse Society, and so you can find it. You can find it by kinesiology, but think of it that all these very fine methods of measurements, they are perfect, but they give the result of this day, or of this week, or of this month, the constitution and the condition of this time. But the condition and constitution, they very quickly change. I've seen with many of my patients, in January everything was okay, and in February he was a bad man. So, but what can we do? We just can take the condition of the day when we have a plan of, for example, for implantation.
Let's say you had a residual osteitis of a long-standing, 25 years. Does it always palpate sore or painful?
Yes.
Or can it feel good?
The chronic osteitis, for example, you wouldn't find anything when palpating. This is a problem. By palpating you never find any chronic condition. You will never find if there is a dead tooth. It gives no hint, no reaction. If there is chronic osteitis, no reaction. So you just can use it for functional disorders. And functional disorders, they are in a regulatory status which can be changed. But think of it, what we talked about this morning, how many patients are in a blockage and no regulative therapy will be able to give any help.
Is this chronic functional disturbance always characterized by inflammation? Or the acute one, the acute one characterized by inflammation?
It depends on. The chronic, there may be a kind of inflammation, but all the signals in this state are so on a low level that you don't get any hints. In the acute stage you have it. And the functional disorders, very often they are more a kind of irritation. Not sure if all of these irritations can be called an inflammation, but these irritations, which are very typical in the functional disorders, they give the very good hints. And in this way, acupuncture is best in the pre-morbid state as a prophylactic method, before all these chronic conditions have become deeper and deeper in the organism of the body. But you know, more and more of our patients now suffer from these chronic conditions, and this is a problem.
If a person comes to you with a pain syndrome which is not immediately obvious, do you palpate all these places in the mouth routinely?
Yes, I do.
If it's insensitive, is it still worth trying to inject it? And do you perceive these things as an initiator, as a multiplier, or as a blockader within Professor Hopfer's scheme?
It's the same as we have heard about this morning. Think of it, many of our patients, they are not at all sensitive. When palpating, you don't find any information. In most cases, it's a bad sign. Then you have the same as we have heard this morning, patients that have had too much remedies, for example, psychopharmaca, or patients that had undergone radiation, tumor radiation, for example. We very seldom find signals with these patients. So, very important what Professor Hopfer said this morning, we have to have a very exact history of the patient. We have to ask the anamnesis, the history of it, what had gone before all these diseases and all these problems, so that we can have it on a line and understand what has happened to the body. Ask for the remedies, ask for radiation, and so you will understand why, for example, a patient which in your opinion might have full of disorders and also palpating disorders, but he gives no information from the mucous membranes or in general acupuncture by palpating the acupuncture points. So it can be the same causes.
But you still inject? You asking
Yes.
You still inject
Yes.
the area?
Yes. This is a rule which can be interpreted in this way. I prefer in therapy these areas that are painful when palpating. But if there are no points to be found, you can begin with these points which in your experience would be useful, according to a chart, according to the experience you had before. But the best is to get a point that is sensitive. Some points not sensitive and palpating, you will find are still sensitive when touching with a needle. So the fingertip sometimes can be too big. It's not the right instrument for gets information. But if using the needle, just the needle, and have this fine dabbing technique on the mucous membrane, then you can get, in many cases, still an information, or you can get this sign that there is an irritation in the point. And this specific technique we will demonstrate later on. No? More questions?
You gave the upper retromolar space the symptoms like shoulder pain,
Yep.
bursitis, knee pain, vertigo. How about the lower, some symptoms for the lower?
The lower pain area. For example, this area, again, the wisdom tooth and the retromolar space area in the lower jaw. If patients come with lumbar pain, with sciatica, I have learned that most of them are painful in the area and on the homolateral side where the pain is felt in the body. For example, patients with an acute lumbago comes into me and I feel in the oral cavity and his lumbago is situated on the left side. If I have a heart palpating with my finger here in the right side area, he doesn't feel any pain. And if I do it on the left area and the patient is very sensitive in this area, I can use this area for therapy. But if he is not, so I don't begin my therapy in the oral cavity. So I prefer either neural therapy or ear acupuncture or general acupuncture, but whatever, I would not begin in the oral cavity. But
Unless they were sensitive.
less sensitive. But you have to learn, if you palpate, this area has to be palpated by pressure, not just with a light sliding with your finger, but you have to do some pressure on this area. Like a little massage, you go with the finger up and down in this area from the seventh tooth, eighth tooth to the retromolar space, and you can compare with the other side. You will feel it. If the patient is not at all sensitive on the other side, but sensitive on the homolateral side of his pain, of his sciatica, of his lumbar pain, so you can be sure that these points can be suitable for therapy. Therefore, do this palpation, and you get a hint what is better to begin with the oral cavity, to begin with neural therapy, to begin with ear acupuncture. I have learned that this palpating gives me a very good hint what to do first. Question? Okay. So, some more. I just talked about the sciatica and the lumbar gear. So all this area between the upper and the lower jaw's wisdom's teeth. This area here again. This is good for therapy of the cervical spine. You can find several points. It's difficult to palpate in this area. You can experience with your patient if they have the mouth wide open, you can't get it in the right way with your finger because there is no bone under the mucous membrane. And so you have no resistance when palpating. And therefore it's difficult. But by experience you just can use some points in this area. I had learned it by a friend of mine. He's an ENT doctor in Germany, and he had a lecture at the annual meeting of ENT 3 or 4 years ago at Berlin. And he demonstrated that in most cases of cervical spine trouble, by just giving 4 or 5 injections in this area, patients are improved. And he does it in a very quickly manner. I used to look at the points and to palpate the points and to look with a needle if the point is all right. But he just did it 1, 2, 3, 4, 5 injections are done in some seconds. And he's right, I think, so far. He had very good results and he reported in this annual meeting of ENT 4 years ago.
In the center of the muscle area or along the sides, or just different areas on the inside, outside?
It's just this area we will see it now in the next picture. We can go on, please.
On one or both sides?
Better is to do it on both sides. But it depends on, if it's a very acute stage of a disease, it can be enough to treat on the homolateral, the ipsilateral side. But all chronic conditions, long-standing conditions, patients have been suffering for many years or months, it's better to treat both. Maybe in the science of acupuncture, thinking of the energetic level, which is not in harmony, that has to be harmonized, that's better to treat both sides.
And what do you use, Procaine, and how much?
We will talk about it later, but please give me the question later on once more. I would be thankful. There's again a problem with my slides.
You got a total jam here.
So
How deep do you go on your injections?
Yes. Now we talk about the practical side. Okay. The depths of injection. As I have learned more and more, it's most important to get the point, to strike the point precisely, and not so important to have a deep injection. So if you get the very point, as you can call it, it's enough to give just a little bubble very superficially. In this way it's a specific technique, and you can check yourself by the palpating finger. I keep my finger of my palpating hand near the needle, and when the needle stuck in and I give the injection, the bubble comes up. And if the bubble comes up, it has to be felt with the fingertip. And if the fingertip doesn't feel the bubble, then I am too deep in the mucous membrane. So I have a possibility to check it just by the palpating finger. And the results are not at all depending on the depth of the injection. It's nearly better results to have the superficial area but very precisely struck, and this is a difficulty. In some areas you can do it very simply, in other areas it's very hard and difficult to find the points. Think of the last slide we had here. So, as I told from this Dr. Sauer, who just did, what can you call it? 1, 2, 3, 4, 5, what's... yeah, what's the name? Shotgun, a shotgun method. A shotgun method, but why not? If it works, it's okay. Shotgun method.
Have you tried it with just acupuncture needles as opposed to injections?
Yes. I've tried it, and remember the question we had this morning with Professor Hopfe, what is with the injection fluid? Has it to be an anesthetic? Has it to what? It's very difficult to answer, and same question now to me again. But it works in the oral cavity just with needles, but the needles can't stick in the mouth. It's too dangerous for the patients. They could swallow the needles, or you had to stand all the time and had to hold the needle in your hand to be sure that nothing happens. And therefore I prefer to do injections. And again, by doing injections we are very near again to the neurotherapy. I think neurotherapy and acupuncture, especially as it performed in the oral cavity, it's the same, very, very similar method.
This is also heart and circulation meridian point also. Do you find the treatment valid for someone with heart or circulatory problems also in the jaw acupuncture, the jaw acupuncture?
Circulatory problems, they are hard to treat by acupuncture, not only by oral acupuncture or ear acupuncture. It's general. For all acupuncture possibilities, you can if you are very experienced, but I think it's very difficult.
So then you're saying the lower teeth basically would be for treating cervical, lumbar pain. What other types of acute pain have you found being beneficial?
Thanks. We give some more hints now when the pictures are coming up again. Fine, thanks for your help now with the slides. But I pick up your question, okay? And help me if I would forget it. Now we have the other apparatus. Oh? So, again, I just talked about the lumbar pain and the sciatica. If you come near to the premolar teeth and the canine tooth, you can treat knee and hip troubles. Knee and hip. It works best by the area of the canine tooth. And you will find in many cases that this area is sensitive to pressure when palpating, especially in the lower jaw. But it depends on. The question was the circulatory problems.
Heart circulation area.
Yes. We have learned that, for example, to begin treatment, whatever you do, acupuncture treatment or neurotherapy treatment, if you begin in this upper jaw area, you will very seldom find collapsing patients. It's like maybe an uplifting of his circulatory system. I have heard it in a lecture of neurotherapy many years ago by a doctor of Berlin who told a very similar experience that he began all his therapy by injection here near the mastoid area, on the backside of the ear. And he told us, Hainisch was it. You remember, it's an old Hainisch. He said if he begins there, he never has seen collapsing patients in the therapy after it. And I say similar experience here with the end-old area here in the Wisdomsteen's area. Also patients which are in bad conditions, and I'm not sure if I can give them a treatment with acupuncture, but if I begin with these 2 points, I've never seen collapsing patients. So,
Use the microphone.
Fainting.
Syncope.
Oh, yeah, syncope. Thanks.
Is the point that you're pointing to, is that
This is essay.
mastoid, is that in the
This is again, it's the same area.
retromolar
Retromolar.
space?
Now here again you see the tuber of the maxilla, the wisdom's tooth area, and here this is the surrounding.
Behind it or into it?
You can do it on the buccal side and behind it. The best areas to be treated are on the buccal side and on the distal side on the behind the tuber. But sometimes you need also points in this area on the borderline to the palatum. Oh, good. Better now? Good. Thanks. Some more questions, okay?
Is that only on the right side or both sides?
No, both sides. Both sides. I just had the picture here on the right side. You can do on both sides. And once more, if there are very chronic conditions, it's also for the sinusitis I talked about. If I treat sinus patients, I always give treatments on both sides. It's better for balancing the bodily energy, fluid, and to balance the autonomic nerve system, maybe better by treating both sides, especially in these sensitive areas. But when palpating, you will find that one area on the right side, for example, can be much more sensitive than on the left side, or vice versa. Good. Now,
Did you say that you use this for sinusitis predominantly now instead of the conventional allopathic medication?
yes. And I can say it in case of sinusitis. I told before that I had learned sinusitis treatment from Professor Hopfer in neurotherapy courses. And so I really had learned that sinusitis can best be cured by these methods, by regulating methods.
You were telling us that there are certain points that are suitable for treating sciatica, knee pain, hip pain.
Yep.
Do you have a feeling what proportion of patients who present with these symptoms are likely to be helped by these injections?
Same question or same answer that we had this morning. If the patient is free with his regulating system, it's okay. But if the patient in a way is blocked,
Assume he's
Yeah.
free with his regulating
System.
Will you cure 1%, 99%, how many?
it's very hard to say it in percentage. But the same experience we had heard this morning. If a patient it's a specific area of pain, doesn't react, doesn't give any results. I never give more than 2 try. For I've really seen same what Professor Hopper said this morning. It's not at all idea to go on with a third attempt. It would never help. But you can look in these cases, or if it takes the same example we had this morning with knee troubles, if you have seen that it doesn't help to do anything with the knee by acupuncture, by neurotherapy, then you have the possibility to give a try, to give an attempt with the knee area in the mouth, which is a canine tooth area, or to give an attempt in the ear, for example. The specific ear point I will teach you tomorrow. So you can give an attempt, or there's a third area we can find at the hand or here at the skull. But if all these areas don't work, so in these cases you really have to realize this is disturbance field behind it. That you first have to give some help the patients by sending him to a dentist or to an ENT doctor, that he has been cured with his teeth or whatever it is.
What about conditions like trigeminal neuralgia or facial pain?
Facial pain. We see it very often now, the facial pain, maybe there you have the same experience. Not the typical trigeminous, but the atypical facial pain. It is increased, fantastic now we have seen in the ambulance of pain clinic in Munich, many patients with such pain conditions in the face, very often correlated with the TMG, very often correlated with specific areas sensitive to pressure in the oral cavity, and sometimes it helps very good to give these injections. But again, if there is a disturbance field behind it, if there are dead teeth behind it, an impacted wisdom's tooth or whatever, so you wouldn't get it. You wouldn't get any help to the patient, and it has to be cured in the way as we have learned this morning.
Even no temporary help sometimes?
The question of the temporary help, and I think the very similar answer you would get by Professor Hopfer. Sometimes we have patients that the first treatment gives a help for about 3 days, and the second treatment gives a help of 1 day. And so you see it diminishes and diminishes every time. So it's the same answer is again open for us, that if you have this sequence, diminishing, you have to think of the disturbance field, for you can't come over it. The patient in the first attempt had the most power to overcome it, and the second time less, and third time less, and so you had to change the idea of treatment. Okay? Good. Now, once more, the area of this tuber maxillary, you can treat from the buccally side. That's the normal one, it's the most sensitive area. This area on the distal front of it is not so sensitive and palpating, but you have to include it in therapy. I've seen patients with shoulder complaints and treating at this area and asking them how they have to move their joints here, and so they said, yes, now it's better. But it doesn't go this movement, the movement back, for example, the movement to the neck, or the movement here to the back side. So I gave some more points, for example, on the palatal side, or on the distal area of the tuber, and suddenly the patient said, oh yes, now it's better. So we have learned you have to extend the area of treatment sometimes around all the tuber with 1, 2, 3, 4, 5 injections. And if you have struck all the points necessary, then the result is okay. You have to treat it. And an experience in this is that if you use local anesthetic in a high percentage, when you repalpate after you have begun your treatment, the patient wouldn't feel anything. For now it's anesthetic, all the area. But if you use a very low percentage of anesthetic, the patient still is sensitive when palpating. But the area is treated already. So in my opinion, it is very good to have a not so high percentage local anesthetics, especially if you use palpating as a checkup.
What do you call high and low when protein and lidocaine
Yes.
1 and 2%?
Yes.
Anyway.
It's difficult to give the answer. I have tried to use with a low percentage, and I came to the experience of 0.5, for example. That's good for results, and in the same way good to give enough information when repalpating. So if I use 2%, it's too strong. 1%, it depends on what. If you maybe in this degree of 0.5, it's okay. But whatever you use, have your own experience. I think there's no law behind it.
Are you distal to the tuberosity there? Are you back behind it to the ambular artery? Is that where you're at?
I didn't quite understand, but you ask here, is this area?
Is it behind the tuberosity?
Yes, it's just behind this area where now my stick is here. Just behind it. On the buccally side, just behind in this area, but also upon the tuber you have sometimes to give an injection. And a little on the palatinal surrounding here, sometimes necessary too. But never I have used this palatinal area. I don't know why, I never used it, but in neurotherapy we don't use it. Just in the adjacent area of the teeth, but not the big area of the palatum. But it's very sensitive when using it, but maybe that there are many points we have not yet discovered. Maybe, I don't know.
What about the nasopharynx behind
The
the...
nasopharynx, we will hear it by Professor Hopfe, because there's a very important technique of injection to the nasopharynx. But I think it's more in the neurotherapy, and we will get it next day. Okay? So we have the next slide, please, if it works now. Not yet?
I'll bring a new tray.
Doesn't matter. We have so many questions. Yes. Now we have once more this area, the upper wisdom tooth, the lower wisdom tooth, and the area between. Here is a plica, and we talked about the treatment of cervical spine troubles. So, as I told you, you can have your injections in this area. Palpating this area, once more, is very difficult and gives no good results. So you have to do your injections at any places, or if you have learned, you can give a little play with a dabbing needle in this area. And mostly you will find that some areas are very, very soft in the mucous membrane, so soft that the needle nearly drops, that the needle sticks without injecting, but just the needle haften, wie sagt man, the needle is sticking. The needle is sticking at these places, and so you know that this area is better for treatment than the adjacent area where this sign was not to be seen. The weaker the mucous membrane, the same phenomenon on the skin in general acupuncture, the weaker the skin or the mucous membrane is, and the more the needle is sticking by itself, the better the point for using for therapy. That's the law behind it, but we have no improvement.
Have you found a correlation with the height? The higher up is high cervical and you come down low cervical? Have you seen maybe C1, C2, a correlation with high cervical, low, I mean, almost like Adler points? Would there be a correlation there?
Yes, the question is, for example, the cervical spine troubles, the different movements, for example. Sometimes the movements were improved, but the movement of rotating did not work so well. So I've seen, for example, for rotating it's best to have a point inside the lower jaw, in this area, against the 9-tooth area of the lower jaw. Sometimes you need a point which is very near to the arcus palatinus, to the injections we also do in neurotherapy, against the same field.
So a console may come into play on that also.
And in my experience, it is very good to include the methods of neurotherapy, giving the injection to the tonsils, as we had been told this morning, to give the specific areas to the tonsils But very important area is this here, and it is the level of the surface of the teeth. If you go on with your finger on the surface of the 7th and the 8th teeth, and you will just go on with your finger with your instrument, you will come to this area. And this area is a very important area here for the cervical spine trouble, especially also a little to the lingually side here. So that you have 1 or 2 points in this area too.
How about the tonsil? We have a picture of tonsil. You just give 2 points lower and upper tonsil?
Yes, but I think Professor Hopfer will demonstrate it tomorrow. For in general neurotherapy, we have the point at the uvula and the point at the root of the tonsils. And this is in the middle. This is about the middle of the tonsil. So I have seen that it's very important also in the treatment of the interference field to include this area, also for the tonsils injections. So it combines again all these methods. Okay. Now the next may be the lower jaw once more, and yes, okay, it was okay. Doesn't matter.
Quicker. Speak.
We have so many questions, so good. I speak too fast?
You have to speak faster. Well, I
Are you palpating with gloves or finger cuts?
The question, yeah, what is best? I don't know. The dentists have their fingers in the oral cavity all the day without gloves, is it?
Not anymore.
Anymore?
Well, they're not supposed to.
How do you use now? With
Gloves.
you use it?
Yeah.
But some of you do, some others do not? I don't. I remember when I was a dentist, I had my fingers in the oral cavity without any gloves, but maybe it's now in the 8th area it is changed. Yeah. It's a question of your feeling. If you have the glove on your fingers, you're not so sensitive as a finger. But I have learned to use a little just for one finger. I have it here with my, yeah. I like to use it, and when palpating, very often you get so sensitive that I think it's not a big difference if you do it with or without. You know, this has a little, what's the name on it? Fingers, the rubber fingers, yes? Oh, it's enough if you do it or if you have a glove. So you can do as you like, but it's just depending on it that you are enough sensitive with your finger. If you are, everything is okay. But we have had the most of our slides, so it's not such a pity if we don't have our slides now. For the most points used, we have talked about, especially in the oral vestibule. And again, if you use the points in the oral vestibule, you just open the lips in the lower or in the upper region, and then you can palpate. And if you have found the specific sensitive area, you try to keep it with your finger, and then you take the needle and put it at this specific area. So this is just the same as we had before in the photographic, and now the more schematic one. Again, this here would be the places for neurotherapy injections, and here again it is the place for treatment in the oral cavity, for example for cervical spine troubles. And you ask for the yes, but also in the middle, also in the middle. Also in the middle and in the inside. For this is just a suggestion which points may be used. But it can be less, it can be some more here in the middle or here in the middle. And think of the problem of the wisdom's teeth. We have heard this morning, it was very interesting for me also with the patients with multiple sclerosis. For I have seen the same problems with the wisdom's teeth area. And you can also begin with these injections also if they are still impacted. sometimes there can be results and teeth are still in the bone. But sometimes we have the same phenomenon. The first treatment gives good results for some months, for some weeks. The second less, the third shorter time. So then you know you have to do some surgical therapy to take out the wisdom's teeth. For your treatment by a conservative way was not successful. It was shorter results, shorter results, shorter results. So you know that is a hint for another necessity. Yes, thanks.
We're ready.
Yeah.
Will patients who experience obvious trauma to the extremity consistently develop these points of tenderness in the mouth?
The patients that
A patient who experiences obvious trauma, for example, to the knee, will he
can
develop these predictable points of tenderness in the mouth?
which can it's just one.
Ob die Patienten, die irgendwo an den Extremitäten ganz klare Trauma haben, ob die diese referierten Schmerzen an den Punkten haben werden.
Sometimes they have not. It's very hard to say. If you later on I give you a picture here from the research work in Russia, that in animal experiments we have learned that if you give a traumatization to an inner organ, or to a leg, for example, to an extremity, that very soon it comes up the information to all the reflex zones at the earlobe, in the oral cavity, at the hands, at the nose, at all the specific reflex zones. It takes just some seconds and the information is to be seen at very specific places. And you can check it by measurement before this injury done. In the earlobe, for example, you have the measurement of all the zones, and if all the zones are neutral, they have no information, and now you give an irritation, for example, by a warming lamp to the stomach, and after a very short time it comes up an information at the stomach point in the earlobe, and the same a stomach point in the oral cavity, and again a stomach point near the nose, outer side of the nose, and in all the different reflex zones it comes up very, very soon. And the question is now, how long does it stay? If you put off the irritation, put off the traumatization, it disappears after half an hour, after 1 hour, sometimes after 2 hours. But the same problem we heard this morning, if this organ had been sensitized before by any injury, and it was on a not good state in the autonomous nerve system, that it was already sensitized, and now you give the next injury, the next traumatization to it, it gives quite another answer. It's on a higher level and it's very hard to get it down again. So it doesn't disappear after half an hour or 2 hours as in other cases. It sometimes stands for days or just remains. It's very interesting. That is, depends such a lot on it. This morning we heard about the second stroke, Speransky we talked about. I have read in the American books here of the trigger points. They have another word on it. They talk about the injury pool. The injury, that means that this organ had been traumatized, had been injured at any time before. And now there's the information still at this place, but on a very low level. It's like in a pool. It's gathered, as you talked about the archive, information archive, was it? But now the second injury, let it come up, this what was pre-sensitized, and it reacts in quite another way than if it had been in a normal state before. And I think many of our problems in medicine are to understand by this mechanism. If we call it second stroke according to Speransky, or if we call it injury pole according to Zola here of Seattle. I think it's the same idea behind it. And I've seen in many of our patients, please help me, what is Gutachten? Gutachten.
What action?
Gutachten.
That's what if you are asking for some from the authorities to get a concept on any kind of specialty, what they call gutachten in Germany. If you ask a traumatologist to give a concept about a given trauma, whatever, that's what they call gutachten. It's like a
You are asked, for example, as a doctor by the insurance. They will have some more information if the patient now is... Yeah?
It's like a professional opinion. Or
Yep. So, yes. So very difficult in many cases to say, because some of our patients had an injury which was not at all so hard, but the reaction on it was very, eigenartig, very strange. It was very strange and unexpected. And thinking of this second stroke, thinking of this injury pool, we would understand it, but in normal medicine they don't know all these connections. And so I think it's very important to think about it. For we see it in our regulatory therapies. We see every day these experiences. So we have learned that it's a reality, isn't it?
We should take a break now.
Okay, good.
Okay? So we have a half-hour break to visit the exhibits, and we'll be back here in a half hour. So it's at 4:35, I guess.
Oh, my language. My words.
Die bringen uns nicht zusammen, da bin ich scheiße.
Komm, sei mal still hier.
Ja, da bin ich scheiße. Du machst das optimal.
Weißt du, ihn zu hören, das ist dann ein Genuss. Und ich habe immer den Genuss gehabt, ich habe erst dich gehört und dann habe ich ihn ja nochmal auf Englisch gehört. Das war natürlich einmalig.
Das war wesentlich besser.
Das ist besser.
Das war besser, wie er gebraucht hat.
Nein, diese Doppelinformation, weißt du?
Ja,
das ist immer großartig. Du hast den Satz also eben verstanden und jetzt kommt es nochmal auf Englisch. Jetzt begreifst du eigentlich erst das, was du vorher noch nicht ganz vollzogen hattest.
Ja.
Das ist ganz
Weißt
toll.
du was, wir haben...
Flex therapy. And you can wait and see if it works. If it works, okay. If it doesn't work, you can go on with the next step, and the next step will be then a natological work, for example, by splint. But in this case, we learn that we can do treatment step by step. That we begin with this method, which is the simplest, which is the most quickest done, and the cheapest one. For trigger point injection, it's nothing. It's done in some minutes, and it doesn't cost anything. But if it doesn't work, then you have to go on. But think of it, you can begin with this very simple step in the beginning, especially if the point area on the ascending mandible, especially in this area, used to be very sensitive here. And I've seen cases when the points again were sensitive in the area adjacent to the TMG, but also the points in the upper jaw, retromolar space, as well very high degree of sensitivity. You begin again with this area. For it's the same law as we talked about before. It's not high enough? Not loud enough?
Not loud enough.
I can
Fast
talk
enough.
louder. So, louder? Thanks. So, in this case again, you begin your treatment in the upper jaw area. It's a retromolar space. And in many cases I have seen when treating upper jaw first, the sensitive area, the muscle area here near the TMG and in the lower jaw disappeared. So again this law of superiority. You can take a chance, sometimes it works, sometimes it doesn't work. But so we have to learn the steps we can do first and the priority of special regions as here and the over in the upper jaw. Okay, this you remember this line just for palpating. On the next slide, does it work? Who will look at the slides? Thanks. Now just two slides more demonstrating the open mouth. It's not quite as I suggested to be. The cervical spine takes a larger place here, and the lumbar spine may be more projected here in the area of the 8th and the 7th tooth too. But it's very difficult to give an imagine of it, just to have an impression how it may be. You have it in your booklet, this picture, is it? So, now the lower jaw we talked about, again this area of the wisdom tooth and the adjacent area of the 9th tooth area, and here the points we talked about for lumbar pain, sciatica, but also for points for disturbances in the bowels, in the digestive tracts. What in my opinion seems to be very important is all the area distally of the wisdom tooth. For the dentist as well as for the medical doctors, we have to learn that just the aspect of this area, when inspecting it, when looking at it, also can give us hints that there is some problem behind it. Especially as you look here, the mucous membrane looks like edematous. You may see it's a little swollen, and in this case also if the tooth, the 8th tooth, the wisdom tooth, it's in the right position. It's not impacted, but this tissue behind, it's not in the normal state. We have learned a lot about it by Dr. Adler. You have heard his name. Dr. Hopfer has mentioned his name this morning too when talking about the Adler points. We will talk about the Adler points more later on. But Dr. Adler, who is the most experienced man, I think, all over the world. He's a dentist living at Barcelona in Spain. But now he's about in the 18th, 83 years old. He has finished now. But he had wonderful results when treating this area in patients with ill conditions in many fantastic ways. Multiple sclerosis, difficult disease of the nerve system. For example,
Paralysis.
Yes, paralysis and epilepsy. He had cured some young man just by operating this area, and he told me, if it looks like here, if you see that the tissue is not in a normal condition, especially as there is no bone on the back side of the wisdom tooth. Normally there is a bone, and if it's just a little piece of bone on the back side, and the mucous membrane has to be fixed on the bone plate. And if it isn't, there is a pocket here in this area, and all this region is in a trouble. There's an ill condition which had to be treated, especially if there are young people with diseases that cannot be cured in any other way. Think of it what Dr. Hopfer told us this morning. Especially for the dentist, have a look at this area, and if you don't begin with operation, you can begin just with these injections, with these 2-3 places. You can have the injection here and see what happens, and if the patient is improved in his conditions, then you can also do the operation. But sometimes you don't get results by injections and by this conservative therapy, so you have to begin with the operation immediately. And the last slide now gives us the demonstration of this area on the lingual side of the 9th tooth area. Again, the wisdom tooth area, here again you see there is a little trouble again. And this is the only point I used to treat it from the lingual side. normally the points are situated at the buccal side, and it's very simple to get these points. This area is more complicated, especially if patients are very like to vomiting, very sensitive, so you have to be careful. But you can use these points sometimes, especially if there are troubles in the kidney and urinary bladder systems. Sometimes I have seen patients with spasms in these regions, and they had been to many urologists and had been treated in the hospitals, and they again had their spasm. So, they were supposed to have stones in the kidneys because they had this colic, spasms. But there were no stones in the X-rays, but just one injection in this area and all the problem disappeared. So maybe that there's a focus again in this area which had to be treated.
On that slide, where would you inject on the upper tonsillar fold?
This here is the arcus palatinus, you see here, and here it becomes is the uvula to be seen. Not to be seen, but you will imagine it's the uvula. So you have one point here, and the other point, it's nearly the same as here, and the depth of the tonsils, the ground of the tonsil as we call it. The upper pole and the lower pole of the tonsils. And the third position, in my opinion, is this one here, in the middle field of the tonsils.
The what position?
Middle. The upper position near the uvula, the lower position under the tongue, and the middle position in this region. It's clear? So, now this was the practical side, and now more the theoretical once more, just for documentation. If you will write where you have done your injections, I use the same numbers as the T's, and I give a little O for order, or like a puncture, whatever you call it, and so you can have your documentation for all for your patients. The difficulty is this area, the 9-tooth area, the retromolar space, because in this area we have seen there are lots of points situated very close to each other, and it's difficult to differentiate them. And so I have, in my practice, I use just these little symbols for buccally, for palatinally, for distally, or for lingually, just for documentation. And you can write the number 9, meaning that's the 9-tooth area, the retromolar space. 1 9 in the upper jaw right side, 2 9 in the upper jaw left side, 3 9 in the lower jaw left side, and 4 9 in the lower jaw right side. This is just for the medical doctors who are not familiar with the systems, but the dentists know how to do. But it's just a suggestion how we can document it. Now the chart we get now, the big chart we have not seen now, and I think it's not necessary, for the big chart is the same, but 4 times on the upper jaw right and left, and the lower jaw left, and this is the lower jaw right side. This is according to the correlations of the teeth as it had been elaborated by Voll and Kramer to all the organs of the organism, according also to the laws of acupuncture. For if we look at this chart, we find that there are 5 groups, and these 5 groups differentiated are the group of the incisor teeth, the group of the canine, the group of the premolar teeth, of the molar teeth, and the 5th group is the group of the wisdom's teeth. So in a way we have 5 distinct groups that can be separated from one another, and this separation means that the correlations are very specific to each of these groups. In terms of acupuncture, you can find out that the incisor teeth in a way are connected with the meridians of kidney and bladder. We talk about more these meridians of acupuncture, the general acupuncture, tomorrow morning. But just now, think of it that we have 12 meridians in acupuncture and the general meridians, and you find most of them here in this chart. And what is very typical, that they are connected meridians presented together. For example, kidney and bladder, which are two different meridians, two different lines of points in general acupuncture, but they are understood as one group, as one functional circuit. They work together in a very great measure. And so the same with liver and gallbladder, that are two separate meridians, but here again in the dental correlations you will find that they are one group, liver as well as gallbladder. So they are in a way specific, connected in a functional circuit again. And now you find, if you would have the chart of the upper jaw, you would have this position of the premolar teeth connected with lung and large intestine. Therefore we have here these two, what is the name, the two arrows. That means that in the upper jaw and in the lower jaw they are just this crossing in this way, that in the upper jaw this correlation is to be found at the molar teeth and this at the premolar teeth. So you just have to turn over this and this. There's no problem to understand it. But if you go on, you will see that the premolar teeth in the lower jaw and the molar teeth in the upper jaw are correlated with this, what we call in general acupuncture the spleen or spleen, pancreas, stomach meridians. You find it also in your syllabus, in the chart. And again, in the fourth group, this is a group of the molar teeth. The molar teeth of the lower jaw corresponding with the premolar teeth of the upper jaw have the same correlations, namely to lung and large intestine. Again, these together build a group, build a functional circuit with functions that are linked together in a specific way. And the fifth group now is a group of the wisdom's teeth in the upper jaw, lower jaw, right and left side, and they are correlated to heart and small intestine meridians, again gathered as a specific functional circuit comprising lots of organs in each one of these groups. We talk about these groups more tomorrow or the day later, but just now to conclude that we find 5 separate groups in the dental correlations as well as in the vestibular points. Here are the points of oral acupuncture or oral reflexology. So these points can be used, for example, for treating troubles in this meridian, small intestine or heart troubles. But as these meridians also betreffen also are very close to shoulder, especially the back side of shoulder, the small intestine meridians, and as well as elbow. So you can also treat such shoulder elbow complaints by this area. You understand that we now have a differentiation of the different organs of the body, and if we sum up all the organs which are comprised in this system, we would find that all the body with all its functions and all its organs is represented in such a quadrant. You say quadrant? Quadrant? In such a quadrant. So if we think that 4 such quadrants are to be found all over the oral cavity, we have to realize that the body and its functions and its organs are represented in the oral cavity and at the teeth 4 times. Upper jaw, right and left. Lower jaw, right and left. Maybe that not the totality of the organs are represented in each one of the quadrants, because on the right side, for example, there are more the right organs represented. On the left side, more the left situated organs. For example, spleen and pancreas differentiate more right side represented the pancreas. On the left side, it would be more the spleen. Or for the bronchi and the lung, it's more the right lung on the right chart and the right side in the mouth, and the left part of the lung more on the left side. But if you would consider all together, again you get the impression that all the body is comprised with its function in such a quadrant of the oral cavity. I think all these differentiations, as to be seen here, they are very interesting, but they have not to be overloaded by our suggestions. I have seen in therapy that there is no borderline between. These lines are open. I think we have to, for our documentation and for our understanding, it's good to have such lines here, such borderlines. But in functional systems, as it is a living being, no borderline is to be found. So all these functions go in a way over the limitations that are to be seen here, and one is influencing the next one and again the next one by overlapping. And I think this overlapping phenomenon is very interesting, for we know it by the cybernetical science of today, that a regulatory circuit that normally they, again, what do we call it? They overlap, or they interact, they interfere. And I think we have to understand that these are functional systems, but they are not totally separated. They interfere and they overlap and they interact with one another. And so you understand better why it can happen if you give injections in this area, for example. Not only you may have an effect on specific cis organs, but maybe to the neighboring organs too. Think of it also in the mucous membrane. You can't differentiate it in such a specific way that you think just now I get this and just now I get that. I think it's not possible. And therefore take this chart as an open chart. For differentiation it may be important for us to understand it in this way and to demonstrate it in this way, but for our deeper understanding we have to know that in functional systems all borderlines are open. Is it clear? Now, if we see these correlations, we ask how could it be found and elaborated by electroacupuncture. Most of you have been with Dr. Voll and his seminars or have heard about it, and I just will give some sentence for these of you who have not heard about it and came here first time. When boring and sniping teeth, you can do measurements at the skin, at specific places where the meridians, the lines of acupuncture, general acupuncture, run along. And we know, for example, that this here may be the stomach meridian. And when sleeping teeth, boring teeth, you have measurements at the different meridians. You can have measurements at the kidney meridian, measurements at the bladder meridian, at the stomach meridian, and so on. And you will see that the traumatization of teeth just gives a change of the electrical behavior in only one of the meridians. Only just one is changed in its electrical intensity. So, for example, when boring teeth, here is the 6th and 7th teeth, the molar teeth, you just have a change of the electrical conductivity of the points of the lung and large intestine meridians, not of the others, not of this liver, kidney, heart, and so on. Just these are changed. Same as we talked about with ear experiences, the research with animals I talked about. You remember when you give a traumatization to a stomach by an animal, you will find the same at the earlobe or in the oral cavity and so on. So you can do this traumatization by the teeth, and you will find this law. It's a law of differentiation. It's a law how the organism is to be found or represented in the oral cavity, not only at the teeth, but as well in the mucous membrane adjacent to the teeth. And as we remember the slide we had in the beginning, this is like a line which goes out of the teeth over the lips. Do you remember this information? Not only at one spot in the lips, but like 1 or 2 or 3 points going in one line out of the teeth, incisor teeth, canine teeth, premolars, and so on. So we have a chart which gives us this information and this understanding, and in a way this results of electroacupuncture according to Voll, elaborated by Kramer and Voll, and the experience of oral acupuncture using these reflex points in the oral cavity gives us a very interesting connection again to the general idea of acupuncture. Those of you who have heard about acupuncture before, they remember that there are 5 elements in acupuncture, and we will talk about later on what these elements are and what they comprise. But all the organs that are connected together in such a functional circuit, in such an element group, heart, small intestine group, large intestine, lung group, and so on, you will find all these organs again in their intercorrelation, in their connections to the oral points and to the oral teeth representation. So think of it, if you, for example, as a dentist, do surgical work, and the patient, for example, you would have a preparation or a big operation in this area, but the patient is suffering from stomach troubles in many years, maybe you have ulcer or any other troubles in this area. You have to be aware that this traumatization you give to the patient by sniping the teeth, by boring the teeth, or by having your surgery in this area, gives some more stress to this area which he is weak, where the patient is weak, where the patient has his troubles. And so think of what we have learned this morning by Professor Hopfer. Think of the history of the patient, give the patient questions of his history, his specific history of illnesses, and ask what is his state now, and if it's not a good state, if it's a more acute state, you can wait with your operations and with your work, and you can have treated the patient or sent to another doctor who will treat him first to get a harmonical or a better energetic state within this functional circuit. Another very interesting information I got by the dentist is if you have done an operation. For example, you had operation at the wisdom's tooth, and patient came to you the next day or the second day after operation he was still very swollen, and he had lots of pain in this area. And what can you do? You can give your remedies, pain remedies or antibiotics, sure, but what can you do by reflex therapy? To give an injection in this area may not be a good idea because it's too much swollen. But what can you do instead of? Think of it that all these systems are comparable to one another, that all these connections that are found on the right side, wisdom's tooth, are again found on the left side, wisdom's tooth, or on the upper wisdom's teeth. So you can give your treatment at the analogous points just on the other side, just on the other jaw. You understand what I mean? Now you have the choice not to treat the area that is full of pain, that is swollen. You can now treat the other area which is healthy, which has no pain or swelling, but you can do it because it's the same interconnection for the body. And so it will help you to overcome this trouble. And this is a law of acupuncture we have seen in many cases also in our work in the pain clinic, that patients that have their pain on one side can be treated contralaterally. Contralaterally, that means pain on the right side you can treat with the left side, but you have to try to get the same spot. I remember a very remarkable story in the pain clinic. We had a patient, a young girl who had been amputated very high, her knee after a motorcycle accident. First the leg was still sitting there, but it was so much damaged, and the surgeons tried to keep it to save it, but they didn't success, and after 3 or 4 months they decided to amputate. And then this lady came to our ambulance with a very hard phantom pain. You say phantom pain? Phantom pain. And so very hard to treat phantom pain. But in this case, I remember it was a wonderful story. We asked the patient if she would be able to describe the very place of the phantom pain. So she told us that it was a place where the surgeon very often took his pincette. Pincette? Forceps. He took his forceps to take out the sequesters. Sequesters, you know? The bone bits. And we asked her, would you imagine which place it was? So she took her finger and put it at her leg she had here, so that it was about one hand under the patella. Just here, this place, but on the other leg. And I gave an injection at this place, and the pain disappeared immediately. A second phenomenon. So we have really to think of it that the contralaterally situation is very important in therapy, especially if we have no choice, if we can't use the homolateral side. So think of it that such a chart as this one gives you the idea that you can change, or that you can compare left and right and left, and upper jaw and lower jaw, and vice versa. So you have some more possibilities for treating your troubles within the oral cavity. You understand what I mean?
Is that why sometimes I do the therapy, and this, say like in the sinuses, and this side is clear, and you inject this side, and it reverses itself?
Yes. Especially the question you gave me is sinus troubles. And we have seen, especially in sinus troubles, that this is very often appearing such a phenomenon that it goes over to the other side. And for these who are a little familiar with general acupuncture, the only meridian which in its course crosses over the midline seems to be the large intestine meridian. It's the only one. Also, if you look in acupuncture books, all the other meridians, they are on one side, left or right side. But in the pictures of acupuncture books you find it that it crosses over here to the other side, the nasolabial fold here. And maybe that is the truth, and that would explain this experience I have seen very often too, that you get it on the other side. So better to treat both sides. You do best if treating right and left side it's the same. Some more questions?
Sometimes when you take a root canal tooth out and clean out the chronic osteitis, the opposite side clears up.
Yes, better. It's better you do it on both sides again. So, two things I try to give you as a suggestion. The first one, if you plan, for example, as a dentist, an operation or a hard work of preparation, sliping or boring the teeth, think of the general state, the general condition of your patient. And you can do it first by a very exact history, asking the patient what troubles had been before. The second one by palpation in the oral cavity. And if you are familiar with general acupuncture, you can do some palpation also on other points. And by this you will find in many cases that the plan you had before is not good now. So it's better to wait, or is it better to give some treatment before you begin with your special dental work. And the other suggestion was that if there had been any surgery, or if there's any illness within the oral cavity which cannot be treated as a specific area, you have a lot of other places which can be used instead of. I think it was clear.
You see that the meridians are actually preferential pathways of conductivity in Kissinger's basic ground substance.
In Pishinger's ground substance, yes. I think what we heard this morning about this basic system, the ground system you call it.
Right. What I want to know is, do you, in your thinking, see the meridians, the preferential pathways, of actually being somehow pathways in the actual basic ground substance?
That's very difficult to give an answer to. For I have the feeling, and so Professor Heine explains. You have heard his name and have read his paper in your syllabus. Professor Heine told us that in the Pishinger system we have an informative system, which may be the first one of the and the earliest one in evolution, much earlier than all the nerve systems that came very later as an informatic system. So it is on a very we can call it primitive level, but a level which is really ubiquitous. Ubiquitous. And what we see here is not so much ubiquitous, but it is in a way more differentiated. So I have the feeling that we have different levels. We have the level which is basic also for the understanding of neurotherapy. In neurotherapy, you remember this morning, all chronic conditions of the body, or disaggregation within the basic system of Pishinger can be the cause for any other illness. That means each for each. You know what I mean? That is a system of Pishinger. That's a system which is really all over the body and can cause everything by every other place. And this acupuncture system, or this reflex system, is more a system of order. And I think that both systems overlap. We have the basic system as a basic all over it again, the Pishinger system, but within the systems now we get a specific differentiation, a specific order. So I think also if we discuss with our friends, and you know that I have done so much neurotherapy, and I do it still very much in my practice, that we can if we think about the problem in the patient, we can think in the rules of such differentiation, of such functional circuits. It is one possibility. And in many cases it works. But it can also be the rule that we have heard this morning, that each place can be the cause to each other place. So, you understand, it's a hard question, it is a hard answer for us. But we have to understand that all systems that are such differentiation systems, like this one, can just be understood on the basic of Pichinger's system. And the Pichinger's system may be the deeper one, and the evolutionary primary one. So if the condition is more and more chronic, it goes more and more down. And down, that means more and more to the primary systems. And the primary system, information system, or system of discharge, or whatever it is, I'm sure that may be the Pischinger system, the basic system.
Robert Becker refers to that as the primitive system as the analog system, which is the perineuronal network, which appears to be equivalent to Heim's idea, I think, of the more primitive system before the actual neuronal structure itself was the homeostatic.
Yeah. So I'm sure, thanks for a very good idea you gave us. I think that that is, from my experience, the difficulty in acupuncture, that we just have begun to think in specific directions, in specific lines. They are and they are not. You know what I mean? They can help us a lot in our treatment and in our understanding. But over all these systems there is a law that everything, as Hunike told us, is connected with everything by this basic system of the intercellular substance or liquid. So both is valued, both is right one, and just if we can get it in this way, it's cheap, it's better for us. And therefore it's very important to know the systems and to try to get it according to this systematics. Some more questions, so we go on.
This morning we were told that you inject someplace in the head to cure a problem or a pain in the foot. And today, this afternoon, you're telling us you inject the left-hand side if you've got a pain or a problem on the right-hand side. So
yep.
I think the point is getting across.
Good. So, it's very good, the question. Think of it that in our reflex therapies, as well as in acupuncture, we have to learn that these analogies are very important. Maybe I can explain by the next picture, so I can give the answer to your question. I hope that it is coming soon. This was a whole chart we had not before, but you imagine now the 1, 2, 3, 4 parts. We just had now in this here, but it was better to take all the information for, I think you can't read it. You wouldn't be able to read it, so it was better to have just one of it, okay? And you have it in your own syllabus so you can look at it. Fine. But the next one will be a very interesting one if it is the right one. I'm not sure, but I hope so. If we think of, yes, now there's another one which may be a little difficult now for us. I got this slide, I haven't done it by myself. Last year we had an international acupuncture conference at Prague, Czechoslovakia. And there was a group of researchmen of Eastern Germany, and they had elaborated this slide here with these informations. That means liver, that means gallbladder, that means lung, large intestine, stomach, spleen, gallbladder again, and triple warmer, and this means kidney, and this means again kidney. It's German, but you understand what is the information in this, that in the retromolar space, in this area behind the wisdom teeth of the upper and of the lower jaw, there are correlations of all these organs again. We had now found in the chart divided in 5 groups that could be separated in a good way. but here it's very difficult to separate it. It's very difficult to differentiate it. It's like an agglomerate, like a compound, what do you call it? It's very near to each other and very difficult to say this is that and that is this. So I was very glad to get it, because in my opinion it was the same one, but I was not at all so sure about it. But as they had elaborated, it was now clear for me that also, for example, in the upper jaw, on the palatinal side, it's very important to think of liver. And again on the buccal side, to think of the triple warmer. For these who are a little more familiar with acupuncture, general acupuncture, that's the triple warmer, and as well as the circulation meridians that are included also in the oral cavity, in the retromolar space, in the upper as well as in the lower jaw. So you find lots of information, but they are so near to each other that it's very difficult to differentiate.
The G is circulation.
Which is?
Gallbladder.
G is gallbladder. G is gallbladder.
And what's the MA?
MA is stomach, Magen. MA is stomach and ME is spleen. Stomach, spleen. And this is lung, large intestine. This is a group. Lung, large intestine, stomach, spleen as a group. There was some more question? N is kidney, Niere in German. Kidney. Kidney. I am sure some years later we will get some better information. It's again in the beginning and the research about it, but it's going on. So, some more questions? Okay. Now, I hope we get the midlight meridians. Yes. If you look here at the oral cavity, so we have here the frenulum of the upper lip and the frenulum of the lower lip. You know, you say frenulum? Yeah. And the frenulum, according to the general acupuncture, to the science of acupuncture, is a point or is a final point of the midline meridians. There are two midline point lines in the front side, on the ventral side, and in the dorsal side. But it's interesting that the dorsal midline meridian, beginning at the anal area, that it runs up along the spinal processi, over the skull, over the nose middle, and comes here to this place in the frenulum area of the upper teeth. And the midline on the frontal side, on the ventral side, goes from the genital area over the umbilicus, over the sternum, middle line, over the, what's it, chin, over the chin to the frenulum of the lower jaw. And I was very much astonished when I came last time to China that I learned by Chinese acupuncturists, famous professors who told me that you can treat anal fissures. You know anal fissures? Yeah. By giving treatment in this area. And so you understand what was your question before, that we really have laws of, what will we call it, of polarity. The one polarity, the one pole, is the anal pole. Here it's the region of the anus. And the other pole is within the oral cavity. So think of Freud. I understand. I understood. So the anal area is in a very good connection with the oral cavity by a midline meridian. And this midline meridian runs up the dorsal midline. And as this is the one final point in the oral cavity, and the other final point is the region of the anal organs, you can treat just by this area anal problems, anal fissures. You have again the problem of up and down. What is here, the polarity in the oral cavity, is analogous to the polarity or to the final end of this same meridian in the quite other region. And so you understand what is possible with right and left and right, with up and down and up, oral and anal, or genital and oral again on the frontal side. These are in a way laws of polarity. And if you think that we have 4 polarities in the geometrical dimension, and what it is, right and left, up and down, and there are some more. What is more? Frontal and dorsal is another polarity, and is again used in the general acupuncture by using the same corresponding points. For example, a stomach point, which is called an mu point or alarm point, Segner point, on the ventral side with a shoe point, which is situated near the spine for the same organ connection. But if you use both points in the same treatment, the ventral point and the dorsal point, you have again the polarity, ventral and dorsal. And it works better than just using only ventral or only dorsal side. So the laws of polarity seem to be much more important, not only in acupuncture but also in all kinds of therapy. We have to think of that the body tries to get in harmony. And harmony, what is harmony? Harmony is to be in the middle, to be centered. It's okay, can we say? To be centered. And how are we centered? If we get the middle of up and down, if we get the middle of right and left, if we get the middle of frontal and dorsal, and there's a fourth polarity, and this is the polarity of inside and outside. And think of that all what we do in a way is using reflexes which were explained by Head and Mackenzie, and they called them the cuti visceral or the viscerocutaneous reflexes. That means the connections between inside, outside, inside of the body. So again, it's a polarity. Also the laws, according to Head and Mackenzie, the laws of a polarity, if you would accept it. The polarity that all organs situated inside, that we call the visceral organs, that they have the connection to the outer places, to the dermatome, the segmental laws, and by this connection the body works. There are rules behind it. And you can imagine that all this connection between inside and outside, the visceral organs and all the segmental regions, the dermatome, the myotome, and the angiotome, the sclerotome, in a way that altogether is a functional circuit. It's a functional circuit which is comprising all these organs which are on the same level of a special line, a special spine level. And in this way, you can imagine that all these polarities, inside, outside, up, down, right, left, frontal, dorsal, they can be used for therapy. For the body seems to have the need, an inner program to get everything in harmony, in homeostasis, and homeostasis in a way is the middle, is a balance, and balance is not too much right, not too much left, but balance between. Not too much ventral, not too much dorsal, but balance between, to be centered in a way. And I think, so we understand by these laws that we really can help the patient to be centered. And I think this was your question, wasn't it? Yeah. Good. Now if we have the next slide, we will see that these midline meridians, I think first we have a view of one of the midline meridians. Yes, it is a ventral midline meridian again, one pole in the genital area, the other one in the lip area. It goes still along in the inside the mouth. And here we find very, very important points to be treated. I have seen that also in the modern pain therapy, as we do it at the university pain clinic. The pain therapist had never been familiar with midline points. In neurotherapy, as we learn now by Professor Hopfer, or in general acupuncture, these midline areas are very important for treatment. And never forget these midline areas for treating. If it's on the ventral side or on the dorsal side, I never treat a patient with pain conditions without including one or two midline points. And that can be explained also by our Western thinking, by the reflexology, by Head and Mackenzie, because there is a special nerve rami that go out from the midline right and left, and they communicate from right side and left side. And so again you will understand that this midline is so very important in therapy. Next slide. Doesn't matter. Talking of the midline meridian, of the ventral side, I will give you a very important experience of myself, of my patients. I have been experiencing in many, many years that this area of the sternum in the midline is a very important area to get some information about the momentary state of the patient. If the patient is in a very bad condition, not only in the somatical level but also on the psychological level, if he is very much stressed, you will get the information by palpating the sternum. You have to do it with a little pressure, not just feeling, but give a little pressure on this area. But many of our patients will feel it very painful. And I have seen in my patients in many years, if they are painful in this area, they have problems at the very moment with the immune system. Please realize that the thymus gland is situated on the back side of the sternum, and that all this area may be like an information also about the immune system. But more may be the information about the psychological and the stress state of the patient. I have learned by the dentists at Munich especially, and we have a little group changing informations, and they told me if patients are very sensitive in this area, when palpating the sternum, when they do their surgery, their dental surgery, they have many problems with the patients. The operation is very well done, and it was without any problem, but after operations many problems occur. Patients have dry sockets, or they have a swelling, or they have lots of pain, which can't be explained by the very normal operation without any complications. But the immune state and the psychological state of the patient at the very day of the operation was in a bad condition. And we all change in our states every day, as we know. And so it's very important to have a very simple way to get information. And it's the really simplest way you can have. And so many of my dentist friends, they use this kind of palpating the sternum by a little pressure. And when the patient is in a high degree sensitive, either to treat the patients by general acupuncture or oral acupuncture, whatever you are able to do, or if you are not, to send the patient to another doctor who will do it, or if not, to send the patient to the vacancies, that they have to have some holidays or have the operation done 2-3 weeks later when the patient is in a better state. Whatever but you have to think of it that it is a very important hint for you. Now again, the backside meridian, the tulmo, as it called it in ancient acupuncture terms, it crosses over the processus spinosi, over the skull, and comes over the midline of the nose. And here's a very important point that will be demonstrated in the next picture and goes up in the oral cavity. if a patient is sensitive in a very, very high degree on the frontal side, sternum area, please give another palpation in the respective dorsal area. It's about the 4th and 5th thoracical level. Some of your patients will be even very sensitive on these points. And I have learned that it's very important also in pain patients to give the first treatment at this area. The dorsal side, the ventral side, it's like a, what do you call it? Like the patient was by a arrow. What do we call it? Spear, by a spear. The frontal side in the same area, the same level on the dorsal side. The same level. So give a try by palpating. First frontally and then dorsally. This point here is one typical acupuncture point. It's situated under the knees and under the nose in the middle, and it's called a, let's say, a reanimation point. Reanimation point in therapy, or whatever happens if the patient is, what do you say, collapsing? Yet another word. If the patient is fainting. Yeah? Fainting? Yeah, syncope. Then you can have a pressure, a very hard pressure on this point. You can do it with a pencil. Have you a pencil here? You can pressure very hard with a pencil on this point. Just give a pressure. If you have a needle, you can do it by a needle. You can do it by your fingernail. Whatever you use, give a very hard pressure on this area, and in most cases the patient will be
Rejuvenated.
Will be reanimated, rejuvenated. Fine, thanks. We have learned another experience by doctors in the neuropediatric university clinic in Düsseldorf in Germany. They used this point when their patients began with a, what do you call it, epileptic Anfall, what do you say, epileptic seizure. Then whoever is present, a nurse or a doctor, whoever it is, takes a very sharp pen or needle or whatever it is and gives the pressure at this point, and most beginning spasms can be aborted. They can be overcome. The only is that you are very quickly, that you get it in a very early stage. If you get it, the patient will not have this bad stage of epilepsy. They have done it with many patients in their clinic, and in other clinics they have had the same also with grown-up people, and they succeeded too. But with children it works best. So I give you now an idea. The needle is very, very fine here, and the needle sticks at this point. And this points, for these who are a little familiar with general acupuncture, they will recognize that it is the point small intestine number 3. But it doesn't matter what it is a special area, and in general acupuncture we were told by treating this area you could activate the dorsal midline meridian. The dorsal midline meridian, you know, that which we talked about, which has this course up to the frenulum of the upper jaw. So as I was palpating all my patients in the oral cavity, I had to try. Some of our patients with sinusitis troubles are very sensitive when palpating here over the incisor teeth in this area. And so I didn't use any oral acupuncture, but I just took this point at the hand to check if the idea of acupuncture is all right or not. And I have really seen in a lot of patients, maybe in about 50 patients, that the sensitivity on pressure disappeared in the oral cavity when treating this hand point. And again, it is a law of correlations. And so it's very interesting to get some more informations of the very traditional system of acupuncture. For I was full of doubt when reading acupuncture books and getting all the information. I said, maybe, may not be. I have to feel it, or I have to experience by myself. But after having experiences in so many cases, now I have become convinced that the really special points can activate all a line of points, for example, all midline points situated on the dorsal midline, just by one point, for example, this hand point. And if we have time, we will demonstrate these points of general acupuncture tomorrow or the day later. Fine.
Are you saying that activates the governor meridian?
Yes. It activates the governor meridian, which is the dorsal meridian of the midline. Okay. We have again another point which is situated here in this area of the hand, the point lung 7, which is a point which does the same for the conception vessel. It's a point lung 7. And I have again experienced when patients were sensitive to pressure in the area of the lower incisor teeth, here, this area, when treating the point lung 7 in this area, that in many cases the sensitivity in the oral cavity disappeared immediately in the same moment. So there are such laws. We have to learn them and we have to accept them, that there are connections by all the reflexes and they can be used for therapy. And why shouldn't we do it if they are to be found? They exist.
Am I ahead of you? But we haven't spoke on level of injection, whether it's intracutaneous, cutaneous, subcutaneous, or periosteum.
When doing these treatments, in the oral cavity or
any place, how do you determine the level of
it's a very important question. For if you ask acupuncturists, you will get very different answers. There are some acupuncturists, for example, Professor Felix Mann in London. He suggests that the best acupuncture is to go through to the periosteum. If you don't touch the periosteum, you will not have any good success, he teaches. And there are other teachers, especially in China, and we have a very good teacher in Czechoslovakia, Professor Umlauf. He has learned in China, and his method I will try to demonstrate for you too. He goes very deep in the muscle with his needles. And he says without deep needle insertion, you will not have any success. You will get this, have you heard about the De Qi? I will tell you tomorrow morning about it. But if you go deep in the muscle, then you have a chance to get a good result in treating. And Professor Bischko of Vienna, who is the most famous acupuncturist in Europe, I think so, is now the senior of the acupuncture scene. He just has a needle stick, not deep. He penetrates the skin, but it may be in the muscle or not yet. Maybe in the connective tissue between. And he has very good results again. And I, in my special experience, have tried to get the points very superficially, just intracutaneous, no more. And I have seen that some diseases react very well just by touching this superficial layer. So what is superficial, deep, very deep, totally deep, up to the periosteum? What may we do? I think we get the question the day tomorrow or later, because all the different functional circuits, remember the chart we had here, the chart of these 5 elements, or the 5 functional circuits, they are connected with one of these 5 or 4 layers. The kidney regulating circuit is, for example, correlated with bone and periosteum. And if there are troubles in all this field, in the variety, in a long range belonging to it, it's better to go deep. And if it's more a problem in the functional circuit of lung and large intestine, you can give the treatment very superficial. So it depends a little on the functional circuit you will hit. So maybe that one patient has to be treated deep and the next one you can treat also superficially.
Do you have any experience using a soft laser to treat these points?
Yes. Soft laser we will talk about a little more maybe tomorrow, but I have my best results with soft laser treatment with children. Children that can't be treated by needle, it would be good for children. But if you use the laser, it works very well. But again, what we heard this morning by Professor Hopfe, it depends on that the regulating system is open, is not blocked in a way. And children, normally, they have a very good regulating system, it works. And so you give this very fine laser beam, but you have to do it on the points. If you don't hit the points, it doesn't help. The problem is with laser therapy that the manufacturers will sell the apparatus, it's normally. But they can guarantee that the doctors who use it, that they are experienced in acupuncture, that they are experienced with the specific points that had to be treated. And you can't give a convenience that just these who are experienced in acupuncture and hitting the points can buy an apparatus. It's very difficult how to solve this problem. For I have seen many doctors who have no experience in general acupuncture, in general reflexology therapy or neurotherapy, and they buy a laser apparatus and they have no success. And they say laser doesn't work. And others who are so much experienced with the needle acupuncture, that they say, it works with needle, why may I buy a very expensive apparatus? But I think, again, the middle is right. You can use this laser for all very sensitive patients who wouldn't stand the needle, or in my practice I use it, for example, the patient comes to me today, and I have very difficult with my appointments. So many, you know what is the problem. So the patient next time goes to my nurse, and I write which points had to be treated by soft laser. So I have one or two treatments between the soft laser, and the next treatment again is in my room. And then I treat again by needles. So you can change it. And it gives the patient also the feeling of the treatment goes on. If you have sometimes too long distance between, sometimes I had business of 4 and 5 weeks because I had no time for more appointments. The patients were not, same as they didn't act in the treatment, they were not reliable, that they went on with all the plans we had, and so therefore was it a good possibility to change needle acupuncture, soft laser acupuncture, needle acupuncture, another idea. But you can do as you like. Yes, now this, just to finish this idea, is the typical remote point. You say remote point? Remote point, remote point. And I think this is one of the best ideas of acupuncture and of reflexology, that you can work by remote points. Think again of the problems the patient comes to you with a very swollen knee. What is it? A goose, which it's very swollen, and you cannot do anything now at this state, but you can treat by injections, for example, as we told this morning, to the tonsils, or you can treat at the hand points, at the oral points, at the ear points. All these are remote points, and they can affect the trouble at the knee. And this just only be performed by these ideas of reflexology or acupuncture. And you have just to know the connections, that you know this specific area would be one of these fields which gives an idea to get an energy flow or information to the knee area. So the next one will give you now once more the two midline meridians, the governor and the conception vessel, as they are called in traditional names. The midline meridian on the dorsal side and on the ventral side, and normally this would be the end. When I imagine that in the old cavity the energy flow, or whatever we will call it, the information flow, goes on, and if it goes on, it not will be open here, but it will also be closed in this area. So imagine that this hay may be closed on both sides, and that means, what area is it here? This is a retromolar space again, is it? It's a retromolar space in the oral cavity, and therefore I think it will be the most important area, because it in a way connects these two midline meridians.